Hello and welcome to Medicine Across Borders,
where we explore the global tapestry of healthcare
and challenges shaping healthcare systems worldwide.
Share your thoughts and rate us on our social platforms to help us continue bringing new content on global healthcare. So hello everyone, today we're joined by Milanie Milan, a final year medical student doing clinical elective in some of the top hospitals in the United States. Welcome Milanie, my name is Marilyn and it's a pleasure to have you on the show. To kick things off, just tell us about yourself and what initially drew you to pursue medicine.
Yes, hi Marilyn. Thanks for having me. I love the idea of the podcast. It's an amazing one.
Thank you.
And I hope it can benefit international medical graduates who are interested in doing residencies in the States. I'm a final year medical student from Lebanon. I graduate in June, and this is me, basically. And I can't even maybe remember why I decided to start medicine specifically. It feels like that was like forever ago, and it's like I always wanted it. But there was actually one major event like in my life that first opened my eyes into this field. It was many years ago. I was still in school, and my best friend got diagnosed with cancer, and he had to come to the States for his treatment. So I used to come and spend the summer in New York with him, and seeing like everything going on, living this experience with him or with his family, and seeing doctors here in the States and everything they did just made me feel like this is something I would definitely want to be doing. And I ended up doing it. So
I'm sure
that's,
it was a really hard period in this
Yeah.
time, especially seeing from the patient side and from the doctor side at the same time.
exactly. At the time, I was not a doctor yet. I thought it was so unfair, but then it made me feel like this is where you can make a difference, because the doctors made a huge difference in Jad's life. His name was Jad. Yeah, I just felt like doctors are real heroes, and I would really, really want to be one day. So
And you're almost there, yeah? You're amazing. You can do this. I've worked with you mainly online, but you're really passionate medical student and hopefully an amazing doctor.
thank you so much. It means a lot.
So my first question, what inspired you to pursue clinical electives in the United States? Maybe you answered a little bit. And
Yeah.
how did you go about securing this opportunity? How did you apply, what you did, and how it went?
Of course. So yeah, I partially answered that question. But to be fair, initially I wasn't considering the States. So when I came here, I was like, okay, the US is where I want to be. When I saw the opportunities, when I saw the trials that Jad got on at the time, that gave us hope, and there was always so many options, so many innovations, I was like, I want to be part of this. But then when I started med school and I saw how hard med school is, then I decided on a specialty. Maybe we can discuss that later on. I decided on a specialty that felt almost impossible to get in the States. This is when I was like, okay, maybe the States is not for me. Then all of a sudden, I just had this. I'm not sure how to describe it.
Intuition.
I just had exactly that. I just had this intuition that why not? If this is really what you want, then you can try, you can do your best. And if it works out, then perfect. And if it doesn't, I'm just going to be learning. Meanwhile, I'm going to be still like doing medicine and trying to get to a place where I want to get, because the States is really a place where nothing is impossible, literally nothing. And there are so many opportunities, not just on the clinical side, also on the academic side, on the research side. So I really didn't want to miss out on that specific chance. So I decided to just do my electives here to make sure that this is what I really want, because with the decision to come to the States comes many sacrifices. And I
Yeah.
need to see for myself if these sacrifices are worth it or not, because there are
Never miss a chance, yeah.
exactly. I'm not saying that the US is the only path. There are so many paths that are amazing. Back in Lebanon, in Europe, so many paths. But I'm just seeing if this one is the one I want to take on. So I decided to dedicate my electives to see that, because I already know how it is in Lebanon. And yeah, so this is why I decided to come to the States. How did I secure these opportunities? I have a lot of people asking me this on a daily basis. I think this is the most frequently asked questions I ever get ever since I came here. And I tried doing videos on it, but I'm glad that now people will be able to listen.
With details.
So I would say there are three main ways. One way is to apply through application platforms such as VSLO. This one I didn't choose, but just to put it out there, VSLO is actually a platform where medical schools in the US actually open opportunities for international medical students to apply for clinical electives. The issue with VSLO, the issue is that your home school should have some sort of affiliation with VSLO to create an account for you. And the other thing about VSLO is that the opportunities that you see there actually depend on your geographical area. So, being in Lebanon, for example, I might not see an opening in general surgery in X hospital, and then someone else in the United States or in Canada or even in France might be seeing this opportunity. So it really depends on your geographical area. Sometimes there are not enough opportunities on VSLO for IMGs. Some other times, opportunities that are there are very competitive, and they're also sometimes expensive. But there is this option out there, and it's definitely worth exploring. I just didn't.
Why? I'm sorry, but why you think it's just limited to geographic area? Do you think it's just because of programs in universities?
I would say that it's mainly a hospital that ever since COVID, mainly, a lot of US hospitals and programs stopped receiving IMGs for a while, which made sense at the time due to COVID restrictions and safety. And then after that, some schools just didn't like open that option back if you want. So I guess that's mainly it. It's whether the school takes IMGs or not. And another reason would be some schools are affiliated. They're affiliated with specific international medical schools. Balaman, for example, might be affiliated with X program, and then from me being a student from Balaman, I might be able to see this opportunity on the SLO just because this affiliation between my medical school and this US medical school.
So you
So
have to log in using your university email?
the way it goes is you actually request an account from your home school. They give you the account, and then you can enter and check it. So it's technically this is why I said that your home school should give you access to that. And if your home school does not have the VSLO option at all, it's not an option that you can use in the first place. So it has its limitations and its like pros. But for my electives, I didn't choose VSLO. Although I had the option and I looked some options and there were options, but I just found other electives in using other ways, which I will discuss. The second way is applying directly through the medical school's website. So some medical schools do not use VSLO, and they do have applications on their websites. This is one elective that I'm doing now, and you just go and then apply for this elective online. You just fill an application form, and then you're notified whether you were accepted or not. Of course, depending on many factors, including how competitive it is, how many people applied for it, the period that you want, because sometimes like May is full, but June is an option. So this is another way, and that's nice that some schools do not actually only go through VSLO, because a lot of international medical schools do not actually have the VSLO option. So this is another option that you can do. So what you should do is basically check whether the med school or the program you're interested in only accepts application through VSLO, and if they're initially on your VSLOs, if the opportunity is available to you. And number two, if they have like separate applications on their own website. Some med schools have both, by the way, programs. I'm not sure why I'm saying med schools. Some programs have both options. Some only go through VSLO, some others only go through like separate applications. These are
But
the
do you
two.
think, let's say, for example, if you apply through the website, you think it's considered as private application, like external application? You're applying as you, let's say, as Milanie Milan, not as you, a student coming from Balamand.
Yeah, it's actually this. It's actually like you're applying on your own. Again, most medical schools have either the only VSLO option or only the application option. Very few have both options, you know. but I think it does not change much your chances of getting accepted because both will be competitive. So this will not change the outcome. Now, the third way, my favorite way, which got me 90% of my electives, is usually when I tell this to other medical students, they're surprised, but it's just emails, as many emails as you can. So what
No way.
exactly that. So what I did was and another thing, it's very personal. It's a personal decision. So people keep and tend to ask me, why did you go to that med school in particular? How can I go to that specific med school in particular? And I always tell them, you should not go to that med school in particular if you don't see a point of going there. So it's not just about going to that perfect program or that dream program. It is very nice to go and like rotate and in your dream hospital and in your dream school, but there should always be a purpose behind that, because when you come for clinical, you're coming to meet the people and the program directors and the chairs that might be taking you in for as residents in a few years. So it's very important where you do your electives, and I wouldn't encourage anyone to just go do an elective at X hospital because it's the number one if you don't see a future there, if you don't have a reason to go there. That's my personal
So
opinion.
just apply and make it worth it.
Exactly. And have a long-term plan, because again, when you go for an elective in a program, people are going to know you there and you're going to have higher chances of securing an interview for residency in that program because they know you. So this is another thing to take into consideration. So the first step would be just do a list of places where you see yourself doing residency, and not just where you see yourself, but where you've seen people, IMGs specifically, who matched in these places in your program of interest. So if, let's say, you want to do general surgery or OB-GYN or peds, you have to go and see if these specific programs in that specific hospital actually ever took IMGs from your country or from other countries in their program, because that plays a huge role. This is something else to consider. So this is number one. You do a list of the places who took IMGs. You can also have a list of places you would like to visit, because that's
Yes.
that's totally fine. One of my electives was actually the case. It was my dream to be there. So do that, but don't take all your electives and just to go and see the place, because eventually your goal is to match and to go for residency.
Exactly.
Do a list of these places. A lot of things to consider. If you have family in a specific state, worth considering the schools in that state, because that helps a lot. So have that list, you check the department. So let's say you chose Y hospital and you want to do general surgery. I'm gonna just give the general surgery example. Then you go and look for doctors in the general surgery department. And I'm not kidding when I say I literally emailed every single doctor in that department. Literally
Dedication level 100.
single doctor, and you shouldn't be afraid to do so. People do that as long as you just check the program requirement first. If the program clearly states that we do not take IMGs, there's no point in emailing 60 doctors and asking for an elective that you're not going to be getting. Okay, this would be a waste of your time and their time. So just check the requirement and check if you know anyone who went to these places. Although on the website it's written that you cannot go, this is another story. But just have a background check, ask around just to make sure that like that's it, and then email the doctors. Pro tip: try emailing doctors who are IMGs, so doctors who did their residencies outside of the US, maybe doctors who come from your home school, from not your home schools, from your countries of origin, uh, or any other IMGs, because these are the people who will feel the most with you and would want to help you. And believe me when I say they are very nice and super helpful, and they just want you to get there. The number of Lebanese doctors who pushed for me without even knowing me, you can't imagine. Really. A lot of electives I got were mainly through doctors who aren't even surgeons. I failed them because sometimes, they just don't have time to answer, or nobody answers you. So at some point, I wasn't getting the electives I wanted. So I started emailing doctors who aren't even in my field, because they're Lebanese, and they helped and they pushed for me. So do that. It will really help. In the
Because going across the state, it's not easy. Like, just
yeah,
it's crossing countries and continents to just do that one elective that you really want.
and they know it and they feel with you. So and they always appreciate the extra effort you put. So that's very nice. And just to be clear, because a lot of people also ask, what do I write in this email? Just be very, very straightforward, very professional, but straightforward. There's no point in writing a 10 pages email. They're not going to read it. They don't have time to read it. They receive these emails on a daily basis. I have a doctor who showed me his inbox. I could spend a year and not be able to go through. So just be very straightforward. Say what you want, when you want it, exactly when you want it. So you cannot just say, I want a clinical elective. You have to be open for clinical elective slash observership. If this is a place you really want to go to, you have to be open for a shadowing experience. So you say that, hi, my name is Melanie. I'm a final year medical student from Lebanon, and I want to do my electives in the United States and general surgery, for example. And I'm really interested in this specific program. So I looked up and I saw that, like, you're a surgeon there, and I would really want to rotate in May, let's say, in the general surgery department. Please find attached my CV. And the CV is very important, because believe me when I say they will check it, because when they take someone in, they're recommending someone, so they're technically recommending you to the program. They would just like to have a background. Sometimes they don't check it, but having it like already attached to the email shows professionalism, organization. Just, it's just a good image, and it just saves time for everyone. So just make sure you attach your CV, and then wait. And it's okay. I sent over, and I'm not kidding, 500 emails. I might have received like 20 responses, and they weren't all positive responses. So it's okay. It's not the end of the world. If you really want a place, you have to keep on emailing until you get it.
Yeah,
Unless you say it's possible
that's
to get it. That's another story.
make
And
the
don't.
impossible possible. Do whatever you can.
Exactly, you do whatever you can. I know it sounds silly, and I know it sounds like pointless, but it's not. And initially, I received a question yesterday from a medical student in Lebanon, and she was asking me, how did you know that these were the good, the perfect electives for you? Honestly, I didn't know until I got them. I didn't. I just didn't know. Each elective has a backstory. One was because I was really interested to work with that specific doctor. Another one was because in this specific state, there was something like family members, people there that I wanted to be around for residency, because the like support system and going away from home is a challenge by itself. So that was another backstory. Another story was that my dream hospital, and I really want to go there. You also have to consider, if you're considering competitive specialties and you want to do research for 2 years before applying for residency, you should also be doing for electives in these places. And one advice, what I did basically, one of my electives is a research elective. It's my
Mhm.
next one. And why do I go for research elective? Basically, because being someone who's looking for a research position next year, having on your CV first that you worked in a US hospital as a research, even as a research intern or fellow, even if it's for 1 month,
But you will
that's
have time to work for one specific research in this short
yeah.
period of time.
So that's what a lot of people ask. And you might not work to publish, but that's not your goal. Your goal is to go there, meet the people in this lab, show them that you're interested so that you can get a position. If not with them, then they might be able to recommend you to other researchers. But being in a setting of a lab where people are only focused on research, this is their thing, this is what they're doing the whole day, will actually help you secure these research opportunities and will help you see what you like. Because when you come from countries that are not that heavy on research. I'm not sure how it
Mhm.
is in Europe, but I know that in Lebanon, we do work on research, but not as much as in the US. Personally, I
Mhm.
never had basic lab experience at all in Lebanon. I mainly worked on reviews, case reports, but I never had this basic wet lab experience. And I felt like any PI or personal investigator who would like to recruit me next year would want to see that at least I know what I'm doing and I've tried it. It's better than just going next year and realizing that I don't like to do this, because you're going to be doing it for 1, 2, sometimes 3 years.
Lifetime sometimes.
So it's good to see what you like and what you don't. And I think a research elective, if you have time, and for
Mhm.
example, I have 4 months of elective, so I had like the luxury of being able to take this research elective. So if it's something that's possible and that you can do, I would definitely encourage you to do it because that helps long run, especially for competitive specialties where you know you will be applying for a research position. So that's
Because now recently, the matching process, they really want people who really have a huge amount of published papers. They are
exactly.
taking 100 plus sometimes. Some people, they apply with 100 plus papers published. And the numbers are just crazy in research. Although even if you don't want to go into research,
Exactly. And if you see here in the US, I'm not going to say in all institutions because the institutions I rotated in were very research focused. And I was at Duke for the first month and then now in Cleveland, and both institutions were very heavy on research to the point that literally all of their medical students are involved in research. Some take an extra year to dedicate it to research. And I think for me, I know some people are not into research, but for me, it's very important because without research,
but
the
it's
whole
medicine to keep up with everything. That's the whole point.
evolving. A lot of US students graduate with enough publications, so much more than like people coming from abroad. I think that's changing though in Lebanon. From what I've seen, it's getting better because people are aware and are more aware now that they should be like getting into research the soonest possible. But I would say just try not to take it it's something you're forced to do, because really when you see that result or when you see this paper published with your name, with something new that might be
The
changing.
Russian excitement. I did this.
Exactly. So when you see your name just published, believe me, even if you think you don't like research, you're gonna be very proud that you took part in this.
Yeah.
So just we should try and change this idea
Mentality.
to research. You know. Yeah. But again, not all US medical schools, of course, are that heavy on research, but the ones I visited at least were very heavy on research. Again, to the point that medical students take a year off just to focus on research. So yeah, these mainly. I think I extended the subject a bit, but just to sum it up, you can use application platforms such as VSLO. You can directly apply through the institutions or the programs
Websites.
and not or this you should do
Emails, emails.
as much as you can, again, to people who come from your country, to IMGs. These are the people who are going to help you the most. But I have a lot of US doctors who helped me and who answered me, a lot of them. I'm just saying that whenever you feel like you need someone to just feel with you, that's going to be an IMG doctor. Yeah.
That's quite surprising. I never expected this is one way to just have an elective there.
The way, that's the big way. Yeah, and you can
So,
also ask the people who came before you how they secured their electives. But again, I'm saying this and I'm gonna keep saying it. A lot of people just come and tell me, "Can you please give me the contact of the doctor you rotate with?" No, you can't do that. You can't do that not because you don't want to, but because most of the time, this doctor I rotated with is not a doctor I initially knew. It's someone I got in touch with and I asked for help. Or some people have personal contacts, like family members who know doctors in the US. I didn't have that from my end, but it's not always easy to refer someone to someone being still medical student.
but
So
sometimes it's not the same elective that you're searching for, or sometimes this can go backward.
yeah, and not just that. Again, it's very personal. So maybe this contact that helped me, like, might not be the perfect fit for you. So before trying to go and do an elective with that specific doctor, because I know that X person went there, just make sure that this is really what you want and this will benefit you. Because the point is not just a checklist. Okay, I did my electives in the US and then what? So if this is really gonna help you, then sure, go and ask people who were there. I'm sure they're gonna help because again, when IMGs, the other IMGs here, whether medical students to medical students or medical students to residents, we all feel there are so many IMGs who just made it their mission to help other
Help
people.
other, yes.
I think it's amazing. Yeah.
But sometimes you'd be surprised how people are helping each other, especially in med school and applying and stuff. Because in normal everyday life, you don't see that help.
Yeah, exactly. I think when it's so hard to come to the States and secure these electives and do well, and then you reach that that place where you look back and oh my God, I did it. And then you see someone who's like in a place where you were like
You just need to help immediately.
you can't just say no. And you and every time actually a lot of IMGs who are now matched in the US helped me and gave me advices. And one of them gave me an advice that I'm forever gonna remember and that I am now giving to other people. And he literally said to me, don't thank me. I just want one thing from you, and that would be please, when you reach wherever you want to reach, please help others. This is the only thing
Whoa,
I'm
this is, it
and
touches somewhere.
and the minute he said that, I felt like, okay, this is what I'm gonna say to all people I help. We want nothing in return but to see that you're gonna help at least one person, even if it's with a 10-minute phone call or a 5-minute phone call or just answering a question. So this is what I would.
But you know, at some point, this is the core of medicine.
So yeah, this is something I really it touched me, and I think it should stay in everyone's top priority list. So yeah,
Not lose our humanity.
never.
So, one question before applying to electives, do we need USMLE and how to prepare for USMLE electives and tricks?
Yeah, sure. Okay. So the short answer to that is it depends. For shadowing experiences, so not hands-on experience, you don't need your USMLEs. They will never ask for your USMLEs. Now, if you want to go for a clinical elective, some programs do require step one. Okay. I'm going to say more than 99% do not require step two. Although one elective that I really wanted surprisingly asked for me to have done my step two, which I didn't at the time.
Mhm.
So I couldn't go for this elective. But I think these are very rare. So to be like, to sum it up, for shadowing experiences, you don't need your USMLEs. For some electives, you might need to have your step one. Step two, I don't think it's something that you will need, except for very few departments that like are really few again. And another thing I would definitely suggest, however, to do your step one before coming, even if it's not required by the program you're going to rotate with. Having step one out of the way before your electives is always helpful for two reasons. One, because it's hard enough to find good electives. So when you have your step one, you're broadening your options because some options require step one. Another thing is when you're here, when you're rounding, when you're in surgery, when you're asked questions, believe me, step one is the to-go resource because people tend to think that step one is biochem and genetics and that, and it's not helpful. It's the basic. You need to know step one, and a lot of the attendings here mainly expect you, even during surgery, they don't expect you to know the procedure or to be
Mhm.
like someone whose suture is perfect. Of course, these are things that you should demonstrate, but they do expect you to answer a physiology or a pathology question right because you're a med four student, you're a final year medical student. So it would be nice to have step one out of the way because that will help you in your rotation and in
More
finding.
from your own knowledge.
Yeah, but other than that, you can definitely find opportunities that do not require step one. If by any chance your elective was at the beginning of the year and you did not have time to sit for step one, it's totally fine. But I would definitely suggest doing it. For the other part of the question, how I prepared for it, I sat for step one around 3 months ago, and I'm doing my step two this summer. So I can only give advice on step one for now.
Mhm.
For step one, I know it's now pass or fail, and I'm
Mhm.
seeing a huge mistake, which is saying it's pass or fail and studying for it just to pass it. It's not an easy exam, and the fact that it's now a pass or fail exam doesn't make it any easier. I would definitely work and study for it as if it's graded because
Mhm.
believe me, one, it's gonna help you for your step two. It's the basic. It's the basic, literally. As I said, it's gonna help for your rotations. It's gonna help for your step two, where you're gonna need a high score eventually. That's number one. And another reason is you see the success stories of people who are passing step one, but you don't see the people who are not. And there are so many people not passing this exam, and it's normal because it's a huge exam. It's a very hard exam. When you study for it, it's very doable. You end up realizing that it's not that hard. But if you study for it just to pass it, chances are you might fail it. So just don't. just don't consider it's pass fail. How I studied for it. Okay, so technically, a lot of people usually like to go through boards and beyond, first aid,
Mhm.
study the material before practicing. It wasn't the case for me just because I studied from boards and beyond and from first aid in my first 2 years of medical school. And I was very short on time. I only had 3 months to study for step one because, again, like I said in the beginning, the US wasn't an option for me until early this year. So I had 3 months and I wanted to get it over with before coming for my electives. So
Mhm.
I decided to take the chance of not going through the material again. What I did is do a full pass of Uworld, and that I think is the main resource for step one. You have to do Uworld, and you have to learn from Uworld. That's your learning tool. It's not first. It can be first aid. It can be boards and beyond. I'm just giving these. It can be pathoma. I'm
Mhm.
not like, advertising any specific specific resources. These are basically the ones I used. Sketchy, for example. I'm just saying use the resource that you're comfortable with if you have time, but then make sure that UWorld is a learning tool from you for you, not just a testing tool, because UWorld has so many concepts that you have to learn. And the most important part that people uh, in Lebanon, at least for some time, tend to just ignore is the NBME part.
Mhm.
So the NBMEs are exams that are written that are by the test makers. And I see a lot of people just disregarding NBMEs, which you shouldn't do. It's your golden resource. So your world is your learning tool. NBMEs are is like your to-go place to see if you're ready to take the exam or not. So I gave a month of UWorld technically.
Mhm.
I did UWorld for a month, and then for another month, I just gave a bit of time to start doing a bit of UWorld mixed questions, because at first I was just doing by system. Then for the second month, I was doing mixed UWorld and just trying to study a bit on the side from other resources when I felt like concepts weren't clear enough. And for the final month, and yes, for a whole final month, I was just focusing on NDMEs. Every week I was doing one NDME and I was sitting for it as if it was the actual exam. So I used to take, I'm not sure, I can't remember honestly. I think I had 4 blocks of 50 questions each, if I remember correctly. The actual exam is more than that, but it took like more than half of the day. I used to wake up at 6, do it, take the breaks as if it's the exam, and this helped a lot. And BMEs are very close to the exam. They're easier than UWorld, much easier. The exam is somehow in between. For me, at least, it was somehow in between UWorld and NBMEs. But I definitely recommend doing the NBMEs, as many as you can. The latest one is NBME 31, I think, to this.
Mhm.
So I would try to do at least the latest 4 or 5 latest NBMEs. And another strategy I used in that final month that was super helpful was when I corrected my NBMEs, I used to put like the concept from this NBME on my Anki cards. I'm not sure.
Mhm.
I know a lot of people don't like using Anki, but for those who like Anki, it was super helpful because it's as if I was
Last
repeating.
minute review
It's not
too.
even a minute, it's long term. So I was
Mhm.
repeating the whole month my mistake, and I came to the exam and everything that was a mistake just ended up being in my like long term
Mhm.
memory. I'm repeating it on a daily basis, and there's an algorithm that's making sure that I really just understood that concept. So Anki was
Mhm.
super helpful for me, and I am now using it early on for step prep, even using it for my UWord question.
Mhm.
Back when I was studying for step one, I only used it for NBMEs, but I definitely encourage like learning to use Anki and using it. Unless you're very short on time, it's definitely not the case, not the time to use it. But and I used to use Anki in med school, so that was easy for me to catch up on. You could do a podcast on how to use Anki, by the way.
Yeah, it's like
But like at first.
true, but I also think to start preparing for like step one, actually, minimum you need 3 months. I don't think anyone would consider sitting for the exam on a shorter time. Yeah,
No, definitely not. You
it's
shouldn't. And it's very self-dependent. Again, I said I did it in 3 months. One, because anyway, I've been studying the material for 2 years.
Mhm.
If you're coming from medical school that's not very USMLE focused, you might need more than that. That's number one.
Exactly.
And number two, it depends on your pace. So you shouldn't just take this 3 months or 4 months or 6 months because my 3 months may be a month for someone else. It's just
Mhm.
you have to find your own pace, and it's scary at first because I have a lot of med students who are now sitting for step one. When I tell them to just go ahead and start with Uworld, and this was the case for me, they get so scared and they're like, I never started practicing questions before actually knowing the whole material. And it's true, it feels scary because we're used to just
Yeah.
touching that material and sitting for that exam. But it's different. Believe me, you're never gonna know the whole material for your USMLEs. There is just so much to know that at some point you just have to have the guts to say, I'm gonna start doing your word, I'm gonna learn from your word, and it's gonna be okay.
It's not easy, especially when it's a huge important exam,
Yeah,
and when you know, like, okay, so I have this material, and just throwing the whole material and just doing questions by itself is stressful. For me personally, I don't think I can do it.
yeah.
I'm like, no, at least review the material.
Yeah, you would think that's the case, but I'm just saying try to incorporate your word in. So I'm not saying not to review the material, but
Mhm.
don't try and finish the whole material before doing your word, because believe me, you're never gonna finish the whole material. One day before my step one, I felt like I didn't know 50% of the material because it's so much information. And at the end of the day, you end up retaining the things you learn through practice, through questions,
Mhm.
and the things you read. But again, it's very self-dependent. Some people are very visual. Sketchy was a huge help for me because I'm someone who's I really, really learn a lot from Sketchy. And I used to use
Mhm.
pre-med when I used to take microbiology courses. Ever since my pre-med, I used
Sketchy
to use,
Micro is one
yeah,
of the best. This is
and I used Sketchy for pharmacology, for pathology, for everything. That was me. People were like, I feel like I'm watching a movie. I can do this. Again, but do try until you find what's good for you. And then it's just gonna like initiate a series of good things. Yeah.
So we will just move to the next question. Can you please share whether your clinical electives in the US were paid positions? Because sometimes you have electives, they are free, and sometimes you have to pay for the whole thing.
Yeah, I know that financially it's very hard to come to the
Mhm.
States for many, many people. Like in Lebanon now, we have this huge crisis and it's not easy. And everywhere in the world, I feel now like no
Everywhere
one,
there's crisis, economic.
exactly, no one's happy with that. Yeah. So thankfully, I was able to find electives that didn't require me to pay. Like the maximum I paid for an elective was $500. That was it. There are a lot of options. And again, when I said email doctors, this is one of the reasons why I said to email doctors. Because when you go on the SLO, most electives are paid, like so you have to pay. And sometimes they're huge numbers that you most people cannot just pay because you're only paying for an elective. You're not even considering yet where to stay, the plane ticket, what you're gonna eat. So the short answer to your question is there are so many opportunities where you don't even need to pay. For shadowing experiences, mainly you don't pay at all, unless like if you have to pay, this will be like a very minimal amount, just maybe to do your cards or to give you access to some specific things. So shadowing experiences are good, especially if you want to do more than a month in the US. I would definitely as much as you can. Consider having shadowing experiences. People tend to think, no, I'm just going to go for this clinical elective. Don't. One clinical elective is very important because when you apply for residency, it's important to demonstrate that you actually had hands on experience here. You really want a letter of recommendation from a doctor who can actually say that she worked here and she works well.
Mhm.
Same time, you have to also have uh, a lot of exposure, not just one. So if it comes to going for shadowing experiences, I did that. I did that in one program that I was really interested in visiting, and it
Mhm.
was that experience for me. And I got a very good recommendation from there. So it's not just about being on a clinical elective. Again, it's important, but it's not everything. So one way would be to go for shadowing because these are mainly unpaid. Not unpaid, they don't pay you, but you don't need to pay for them. That's one. Number two, do look at places where the cost is not that huge, and there are such places. So the elective that I'm I'm just gonna share that now. I didn't talk about specific places, not to be biased, but just to give an
Mhm.
here in Cleveland, the elective wasn't expensive at all. I'm not sure how it's gonna be in the future, so I'm not gonna give strict amount, but the
Mhm.
amount is very fair. And you also had options to be on campus, so like dorms on campus for
Oh,
people.
wow.
And I think this is not very you can't find such options in all programs, obviously.
Mhm.
Something because the in-campus option was very affordable compared to someone who wants to live off campus, and that's really helpful. So look at these programs, you will find them. This is why I said email and keep looking. This is why I said to email IMGs and doctors from your countries, because they would tell you about these things that you can not know about. Not sometimes they're just not on the website, sometimes you don't know, so they might help with that. That's another thing. And a final thing would be to try and see some institutions. These are sometimes reserved for US medical students, but
Mhm.
some institutions actually have funded sub internships or electives where they actually pay you or help you for it. So they pay you and help with the rent, uh, your everyday
But
life.
I think this is more for locals. I don't think they will provide opportunities for international students coming there.
Again, I didn't have specific experience, but I recently started being more active on Twitter, and
Mhm.
this I am I wish I was more active 2 years ago, because I realized that on Twitter specifically, and during that time of the year, so after match week and after people matched, this is when programs start opening these opportunities to apply for electives and for away. They call them like away or electives here, and some do take IMGs. Of course, you're not going to be the priority, but some do. So just check that out. I didn't try them to give a specific opinion or a specific place that does that. But Twitter is a good place to look for these things. And again, email doctors, ask as much as you can. Again, I didn't pay much for my electives. Of course, this is excluding the rent and
Mhm.
life.
But this
This
is, depends on every person's preferences, yeah.
yeah,
So,
unfortunately, you can't do anything about that. At the end of the day, see it as an investment. Honestly, I know it's expensive, but try to find ways to make it happen. This is why I was saying the list, because being in a state where you might have family or friends, and maybe you can stay with them, this can definitely help. This is why sometimes that elective that worked out so well for someone might not work out well for me. This is why I said, depending on you, on your budget, on what you want from that specific program or that specific place. So very doable. Again, I came for 4 months and I didn't pay much for electives per se. So
mhm.
it's very doable. Just again, email, try, dig, ask, always ask. Yeah.
So how was your experience in the US?
Till now, it's great actually. I'm finishing up my second month and I'm very happy, and it gave me a lot of insights. It showed me what's it like to live here, and
Mhm.
I keep saying try to do more than a month, because when you come for a month, for my first month, I was so happy to be in the state, my dream coming true. So I was, yeah, I was really not feeling like, okay, this might be my life for 10 years. You know, you're just
Mhm.
happy, feel like you're traveling and not on vacation per se, but like on some sort of vacation. So you don't have time to process that. Is this the life I want? And then when the first months passed, I started feeling like, okay, oh my God,
It's
I'm
happening. It's
feeling
real.
like home, and this might be my life for the next 10, 15 years, who knows? So this gave me a lot of insight actually, and staying that long period is very helpful to know if it's something you want to do or not. And thankfully, till now, it's something that I feel like I really want to pursue. The experience is amazing because you get to see a lot of things that you might not see uh, in your home countries. The
Mhm.
whole system here is different. The way they work is sometimes different. You just get to see, to hear stuff. And what's very nice about the US, at least again in the institutions I rotated in, is how much they focus on education and on academia. Again, I'm not saying in Lebanon we have amazing doctors who really want to teach you amazing residents. It's really the case. But here there's this this vibe where you just cannot leave the hospital without at least learning one thing. So even on the observership I was in, which at first I was like, oh, what am I gonna do? And on the observership, I didn't even have access to the system. I couldn't even see patients on my own. I couldn't even scrub in the OR. It ended up being a more than amazing moment. I would repeat for a year if I'm asked to, because thankfully the fellow I was with and the residents and attendings, they kept on making sure that I was involved in a way. They kept asking me questions, pop quiz questions, that gave me scenarios, that showed me around. Amazing. And they really focused on education here, which I think is very nice.
So how
Uh,
would you rate the real life experience compared to Grey's Anatomy's experience?
it's very different. It's not at all like Grey's Anatomy, but it still feels like something else. Again, I'm not sure why, but you feel like you're in another place. Although it's and it's a hospital, and I've been rotating in hospitals for 2 years, but it's really nice. Another thing that's very nice about here is that I'm not sure how it is in Europe, but I felt like here the subspecialties. So, for example, the endocrine surgery service is purely endocrine. In Lebanon, I used to rotate in general surgery. I used to see a lot of thyroidectomies and parathyroidectomies, but I used to see with the same surgeon a lot of cholecystectomies as well and appendectomies. So I felt like when you rotate in a specific place that subspecialized, you learn so much because you're technically doing the same thing for a while. So you get to study it more, to learn it more. And if it's something you want, so if someone knows, for example, that they want, I don't know, pediatric surgery, coming here for pediatric surgery, you're literally just going to see that one aspect of visceral, for example, pediatric surgery, and you're going to learn a lot from it. Again, when I left my first elective, I felt like I just knew how to tackle everything that was related to endocrine surgery. I felt very comfortable to just take the full history from a patient, present it, ask the right questions. Even at some point, I just memorized the steps of the surgery, although I was just observing, but
It
I
was
just
on repeat.
repeat, and it's the good repeat because the cases are in a way all different, and the patients are different, the interaction is different, and you have several surgeons with maybe different approaches. uh,
Mhm.
that's it. My experience till now is it's a great experience. It's eye-opening. It's challenging though. I'm not sure. I think you're definitely going to ask about the challenges.
Yes.
Yeah. So I just talked about the positive things, but of course there are a lot of challenges, especially
Mhm.
being an IMG. You come and you feel like you're a shadow in the room, even when you're on a clinical
Yeah.
elective. You
Because I
feel like,
think everyone knows each other in the beginning.
yeah, and not just that, it's like when you have other medical students with you who are so familiar with the healthcare system here, who
Mhm.
are so familiar with the way the hospital works, at first you feel like you need to like prove yourself in a way, especially being an IMG. I feel like we always should prove ourselves, which is normal. It's like you're coming
Mhm.
from outside and you're here now, and people are very nice. Don't get me wrong. Everyone was super nice. Everyone was trying to fit me in. Again, this was my personal experience, but even then you feel like you have to gain their trust so that they can start trusting you with patients, sending you, asking questions to patient, taking history. At first they don't know how you do it back
They
in the
just
home.
have to know you, you know?
And this is a huge challenge because it takes time, and sometimes you're here for a month. They like need 2 weeks
Mhm.
to get to know you, and then when you're familiar with everything you have to leave. So
Mhm.
this was a big challenge. At first I felt very down and very bad. My first week was not horrible, but it was
Trying to
hard.
get
Yeah, and I felt like I was constantly trying and not seeing results. And then just with the blink of an eye, literally, you fit in and okay, I know as much as they do. I'm learning so much from them as well. I'm learning new things that I never saw in Lebanon. And what's nice is that they're very open to learn from you as well. They kept asking, how do you do that in Lebanon? Even the medical students, so
Mhm.
sharing mutual experiences, talking about how surgeons do this specific procedure in Lebanon versus how it's done here is very eye-opening for everyone because a lot of things are different. And this is how I overcame this challenge mainly. I just told myself that, okay, I'm here. I'm a medical student like all medical students here in the US. I did
Exactly.
my first one. I know my material. I just have to just stay strong.
Just go in, all in, and it will be okay.
Exactly. And you have to, it's okay. You're not here to practice or to take history or to show them that you know how to do all of these things. The main aim of you being here is to get to know the program, is to show them you're determined, you're motivated, and they see that and they acknowledge that and they really give you feedback here. They really do. So don't feel bad if they don't ask you to do something or if you ask to help in something specific and they're like, okay, no, not now. Totally normal. It's going to take time for them to actually get to know you and start giving you tasks. I didn't know this at first, so I felt super bad. And I was like, okay, what am I doing here? Nobody trusts me. I'm not going to be able to do anything. And then it all turned out very well. So this was a huge challenge at first. Other, of course, than the challenge of being away from home and feeling like uh, you have so many more years ahead. Even when I
Mhm.
came here and I met with a lot of people, I felt like I always knew the like the thing I want to pursue, the specialty I want to pursue is hard. But when I talk to people here, I realize that it's even harder than I thought. And that as an IMG, you have to prove yourself. And it's totally normal. They have a point because you come from someplace else where maybe you practice differently. And of course, they want residents who are familiar with their system and the way they operate. And they do give you a chance to show that you can during electives, sometimes during prelim years, transitional years. So you have opportunities. You just have to have the faith that it's going to be okay and the stamina that it's okay if I did this extra year or these 2 years of research and then this prelim year. It's not the end of the world. Even though you see people your age matching 4 years before you,
Mhm.
believe me, this is something you really want. And this is when I was talking about sacrifices. This is where you draw the line between how much you're willing to sacrifice to come and train here. Because
Mhm.
along the way, no matter the specialty you want to pursue, there will be sacrifices. You're going away from home to train in another.
Exactly.
It's a sacrifice by itself,
It's
honestly.
lots of stressors at the same time in the same moment.
We have what it takes because we come with the mentality that I want to be great and I want to
Mhm.
impress, which is very good
Mhm.
because we always have this motivation that I cannot just fall today. I'm gonna get up no matter what happens.
Exactly. But along the way of med school, with every single exam, you live the same experience and you reach the point where, like, okay, I know I can do this and I will do it. That's it.
Exactly. And you remember, and honestly, we're very prepared for that. So I'm very thankful for the education I got. And honestly, when I
Mhm.
came here, I felt like I knew what, like I knew not everything. No one knows everything. But I
Mhm.
felt like, okay, I got the good education. My rotations helped me so much. When I was asked to take history, to do physical exams, to answer questions, I felt comfortable. Of course, some things are done differently here, but you directly learn them because initially baseline, you're also a medical student and your hospitals and your home schools are as good. They're just sometimes different. So you have what it takes to be prepared for it, but we just have to fine tune some things just to
Mhm.
take to the place we're in. Because even here in the US, when you rotate in two different programs, there are things that are different. So imagine when you come from a whole other country. So, anyway,
Exactly. But it's quite a good, it's not only about career wise, it's also personal growth at the same time when you decide to like to take this big step and just go for it.
exactly. And believe me, I feel like I'm gonna leave here and I'm gonna feel like I did something. And this is
Mhm.
something, unfortunately, we forget that. For example, I'm graduating in 2 months, and my dream was to become a doctor 7 years ago. And now,
Dream come true.
yeah, and the sad thing is that we forget, and now we're stressing about residency. No, you just have to take a moment to just like look at it, and I'm here. And it's the same with my
You
electives.
did it finally.
When I was in first year, maybe I dreamed of just being in the US. And now that I did it, I didn't even celebrate it. And you should celebrate it. You should finish your elective and be like, okay, oh my God, I did my clinical electives in the US. I did it for 4 months, for 1 month, even for 2 weeks, but you did it. So it's very important celebrate that, and it is a milestone, and it's very enriching. Like you said, on a personal level, I learned so much here because I
Mm.
just put myself out there. I went out of my comfort zone. Obviously, Lebanon is a comfort zone, and obviously, I loved my
Friends, families, your own house. So this is the comfort
very
zone by itself.
back in Lebanon. There were many attractive programs. There were great surgeons that I until now I wish I can learn from, and I hope I can learn from. That's it. This is just a decision that you have to make, and this is why you should come on electives to see if this is what you want or not. And if it's not, totally fine, but you try, you check, and now you're sure.
So, Milanie Milan now, Milanie Milan in 5 years.
Yeah. Okay. So technically, I think from my discussion, you probably guessed that I want to go into surgery. Yeah. And I think surgery specifically, I'm not going to say it's harder because nothing is hard here in the US. I literally thought that everything is possible. Everything, everything. If you really want a position, whether in general surgery, in thoracic, and ortho, everything people say like it's impossible. It is possible, but again, there is a fine line between what's possible and the sacrifices you're willing to get there.
Mhm.
From my side, I love surgery and I love working with kids, but for now, my short-term plan, I'm gonna say, is to get into general surgery residency. To do that, I'm gonna work on my CV even more, and I'm gonna focus on research. So currently, I'm just looking for research positions for the next 2, 3 years. I'm not sure how this is gonna go. It depends on so many factors, and then hopefully, I'll be applying to the match to match in general surgery.
For a
Hopefully.
person who took this big step, will be able to make it.
So, so this is the plan. But anyway, I think plans change sometimes. You don't know what happens along the way. For now, that's my plan. I would be more than happy once I reach that to share in retrospective what helped me, what I could have done better. But yeah, that's the plan for now.
So, what advice you would give to all medical students who really wants to apply to the US?
To apply to the US. Really, that's the biggest advice. If you want something, you're gonna get it. Literally, here in the US, there's a doctor that I really loved so much who told me one thing, and she just looked at me and she said, "If you want something, there is no way you're not gonna get it. There is absolutely no way you're not gonna get it." But as an IMG, and this doctor was an IMG, by the way, and she's now attending in an amazing hospital in the US. She said, as an IMG, your currency publishing. That's your currency. And yes,
The golden rule.
research is very important. You have to, you don't have to do research. You have to acknowledge the importance of research and see that it's gonna get you uh, to a lot of places. Another advice, and all these advices I'm giving are just things that program directors and chairs, attendings, and residents told me. Another thing is I was asking a doctor and attending, what's one thing that you think I can do if I really want to match into general surgery? What's one thing that I can do? He just looked at me and said, I want you to come back and show me that you achieved something. What
Oh,
makes what did you achieve? Here today, you're telling me I want to be a general surgeon. When you come and apply for years, what is it that you achieve? Everyone applying to the US is obviously a great candidate. Obviously, it's someone who on their steps and who have research experience and who have their own story to tell. But
what making you you?
yeah, what makes you you? What makes you different? So start thinking, what is it that you want to achieve, so that
Mhm.
you can that show them that they want you. Just show them that you want me and I want you, and this is why it's called a match. Actually,
Mutual benefit. It's everywhere around the world.
so achieve, believe that you can, because you can, and achieve something. Stop just looking at the grades and the USMLEs, even research. These things are obviously important, but you as a person is even more important to them. And you have to find ways to know yourself what you want. Because when I came here, I was asked, what's your research interest, for example. I was like, oh my God, I don't know what's my research interest. Yeah, I really don't know, because I did work in research, but I do like a specific specialty. But what's specifically my research interest? I wasn't sure, and I spent the last 2 months figuring that out by talking to research here. And I actually have now an answer to this question. So just figure out what you want to do in life, what you want to change, how
That's
much.
actually the hardest test.
Yeah.
Trust me, to just figure this thing out.
And being here in the US is pretty helpful in
Mhm.
knowing what you want. And this is an advice for not just people who want to come to the States. I believe anyone who wants to train anywhere in the world, in any program, whether in Lebanon, whether in the US, whether in Europe, they always want an applicant who's a full applicant, who knows what they want, who's obviously good with grades and with research and with everything, but they want an applicant who has a story, who has something to add to their program. So I think the US is like, it feels harder, but at the end of the day, if you're applying to any program in the world, you're gonna need
It's
to meet all
almost
the
quite the
things.
same.
Yeah. So even in Lebanon, I always feel like when you take any like surgeon from Lebanon, or a resident who trained in Lebanon and a resident who trained in the States, they each have their own story. They're both great. They're both amazing. They both
Great in their own way.
in their own way, but they just decided to choose a specific path depending on their own story, where they see themselves in 5, 10, 12 years. Just don't count the years. Do count the years, of course, depending on what you want. Again, there are too many considerations. This is another topic I'm not going to get into, but obviously, there's family, there are personal goals. It's not just about being a doctor, or
Exactly.
it looks like it.
Work-life balance in the end.
And sadly, in medicine, there is no good work-life balance most of the time, but
Mhm.
find it. And another thing, by the way, that a doctor told me here is, now is not the time for stability. You're gonna get stability eventually when you're done with your training. You will be stable. You will be able to
Mhm.
decide how much you want to work, whether you're a surgeon or a pediatrician or a cardiologist, whatever. You're gonna decide your own pace. No matter the specialty, there are always ways that you can say, okay, this is how I wanna operate my, I don't know, my private practice, or I'd rather work in a hospital, I'd rather work full time. This is what you decide. But now, as a medical student who wants to come to the States, stability is not an option right now. You should just push and see the long term plan and the long term goal. And this is going to keep pushing you. And
Because
yeah,
sometimes plans keep on changing.
and they
You
not
cannot
sometimes.
plan something for 5 years from now.
Exactly. They always change and they will keep on changing. And when something doesn't work out, I believe that that's because something else is prepared for you. And I had a lot of experiences personally, things that didn't work out and that felt horrible at the time. And now I'm very happy they didn't, because I'm in so many places that I never hoped I would even be. And my electives are a big example of that. There are so many electives that I wanted when I started my final year that I couldn't get for a lot of reasons. And now I couldn't be happier and prouder and more excited about the electives I ended up getting. So when a door closes, another one will
Another
definitely
one
open.
opens.
Just trust the process.
Yes, I would like to thank you so
Yeah.
much, Melanie. It was a really incredible, like for your journey and for our conversation. It was really exciting to hear about your experience, and I think it will give motivation for lots of medical students hearing this. And we wish you, we wish you all the best in your future career in medicine. And ending this episode, I will end it with just choose your goal, achieve your goal, you can do it.
Thank you so much. It was
Thank
amazing. And thank you for having me. And again, if anyone needs any guidance, any help, any question, my door is open always,
you.
anytime.
Can
Yeah.
you can check Milanie Milan on her Instagram, mmdgram.
Yeah. It's m.mggram. And again, one condition, just make sure you help someone in return. That's it.
Thank you so much, Melanie.
Of course, my pleasure. Thank you, Million. And amazing podcast, amazing idea to actually have medical students have like a specific place to go to when they have so many questions and they want in-depth like discussion, not just 2 minutes a
Yeah,
reel.
that's the whole goal of this. Thank you so much, Melanie,
Of
and
course,
thank you for your time.